Zendocrine, again, would be in there to get rid of excess plastics in the system. Wild orange, fennel, Mitotumax, balanced phytoestrogen. And phytoestrogen is not an essential oil. It's actually a capsule that has proper estrogen stimulants and precursors for a woman's body. And what I mean by that is you don't just put estrogen in a woman's body. Why? That can be dangerous. They found that out with hormone replacement therapy, didn't they? But if you put in, remember how the thing goes here and then here and it breaks it down, goes here and breaks it down, goes here? You put in all the precursors and the woman's body then separates it and takes it as it needs it and uses it in the appropriate manner. So you take those precursors and put them in and you put what are called estrogen cell site transduction modulators in there, which means that estrogen now behaves itself properly at the estrogen receptor sites rather than overwhelming them into a cancer response. The phytoestrogen works very good on that as well. Ylang-ylang lavender. Again, the vast majority of these are things that are going to calm down the nervous system, calm down the adrenal stress system, so that then those resources get diverted into the proper cycling of the hormones. And again, that even goes to the pituitary gland to have proper timing and amount of the luteinizing and follicular stimulating hormone for ovulation at day 14. Now, the peri or postmenopausal issues, again, this is the postmenopausal woman who's got the hot flashes and all the, the androgenization and the, all these problems that occur. And here, just take more estrogen. You feel fantastic. Bad idea. Here again, you take a look at these. They tend to be calming, but there's some of them, like peppermint, that would be more stimulatory. Because again, we're talking about highs and lows. Most women have more lows than they have highs at this point, but we still need stimulation. I mean, a woman's body's cells are used to this much hormone. And then menopause happens, and now you have this much hormone. And, ratios and balances and which one is which. But overall, there's this much hormone before, and there's this much hormone now. And the body says, please give me more. Even if it's dysfunctional, give me more. Okay? Point is that you need to stimulate it with things like peppermint and Roman chamomile, because those are going to stimulate more activity to happen, but we also need to calm it down. So again, what we're doing is modulating. We're eliminating the highs, we're eliminating the lows as well. For pituitary pineal things, you'll find these every once in a while, especially in kids who have a lack of development. They're developmentally delayed is another term for that, where they simply don't grow as fast as they need to. They don't develop as fast as they need to. You can have like 16-year-old girls who haven't even approached getting their cycle yet, things like that. In that case, frankincense, sandalwood, myrrh, vetiver, ylang-ylang, ginger are all very good, again, to stimulate the hormones to go where they need to go. But in that case, there's almost certainly a metal detox needed, again, avoiding all grains and dairy, and a low glycemic index diet. What does that mean? Cut out the sugar. Get the carbs out of their life in a big way. Now, there are adults with pituitary pineal issues. My wife's aunt was born with a pituitary problem and has to take pituitary hormones every day of her life because she just can't produce them. Again, that's probably due to one of the rare cases where there is actually a genetic problem in the family with that. Okay, but that's not usual. Now, metal detox, let's get into that. I mentioned metal detox several times. I can guarantee every single one of you people have metal in you that would be toxic and is actively producing free radical damage to your body. You can't avoid it living in our society. It's in the water, it's in the air, it's in your dashboard of your car, it's in your food, it's in your cosmetics, it's everywhere. Especially if you take vaccines, especially if you allow a dentist to put metal in your mouth. You're going to have metal in you, mercury being the worst of it. My protocol for this is 5 drops of the cilantro oil, 5 drops of the Zendocrine oil, or there's also now a pre-made Zendocrine capsule you can buy. I made this PowerPoint before that was a product. You can just take the capsule. 1 drop of helichrysum. If you want to just also do chemical detox, you can throw 5 drops of lemon in there. And you do that in a capsule 3 times a day.
Always?
What I would generally suggest for most people is do about a good solid month of that and take a break for a little while, maybe a couple weeks, and then go at it again. Perpetual metal detox will wear out the system. It'll tend to detox out some minerals as well. And the availability of the non-peptide bound metals tends to diminish over time as you're detoxing and needs to redistribute over time. So taking a break can cause that redistribution to happen. But getting metals out of the body, I can tell you, I mean, if I did nothing in a practice but detox metal out of people, I would take care of about 80% of people's problems. I mean, metal is at the root of almost all free radical damage and almost all inflammatory, degenerative, destructive processes.
Is
Yeah. Oh, go ahead.
Is that safe to do while you're pregnant, the metal detox?
There's an argument there, and I can't decide which argument it would be one way or the other. I've had this question before. Number one, if you're detoxing metal, that means that the metal coming out of your cells is getting into the bloodstream, and you're sharing your bloodstream with the fetus. So that means metal would be moving towards the fetus. The problem with that is metal moving towards the fetus anyway, because mercury does pass the placental barrier, and 1/6 of all children born in this country are metal toxic. So you're going to give that baby metal anyway. By doing a detox, you're increasing the amount that it's getting, but on the other hand of that, flip the coin over, now you're also giving that baby the ability to detox metal. So my viewpoint of it is you could, but anything where it comes to babies comes along, anything going with pregnancy, you have to be super cautious. The last thing you ever want to do is affect the pregnancy in a negative way, because you'll never, ever be trusted again. No one will ever come to you again. It's a bad, bad thing to have a problem go on there. But, again, I think if you're talking about fear, I think it's safe to do during, and maybe even, especially before pregnancy happens. Very advocated, yes.
Thank you.
And digestive reconditioning. Our digestion is so embattled. It's almost as if somebody laid out a program, let's kill everybody's digestive system and here's how we're going to do it. And that is our food system, that is our environmental system, that is everything about our whole environment that we live in. It's almost like somebody said, let's kill the digestive systems. In this case, On Guard capsules, 6 per day for 10 days. There's 60 in the bottle. So you take a whole bottle of On Guard capsules in 10 days. Now what's that going to do? It's going to kill bacteria, mold, it's going to kill bacteria, parasites, and viruses. Now, you, being the average person, are going to have a plethora of bacteria, parasites, and viruses in your digestive system and your system system as a whole. Okay? So taking On Guard over that period of time is going to simply blow a lot of them away. And these tend to be the things that are of larger size. Organisms, they tend to be a little bit bigger. They tend to create a lot more waste. So you're hitting the bigger ones first. Then you take GX Assist 3 per day for 10 days. Again, that's the 60 count bottle. You're going to do that for 10 days. GX Assist is more oriented towards mold, fungus, and yeast. Mold, fungus, and yeast are those opportunistic spores that grow in a system because of our environment. Okay? And most people who have recurrent Candida problems have metal in them. Candida is never, ever, 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 ever a primary infection. Candida is there to clean up a mess. Candida actually has a function and purpose in your digestive system to clean up dead cells and debris. If it's in overgrowth, there's too much debris and dead cells. Why are the cells dying? Metal toxicity, almost always. In fact, there's remediation crews out there. In other words, let's say there's a toxic spill of mercury at a plant somewhere. You know how they clean it up? They put a medium over it that's filled with mold. They grow the mold absorbs all the mercury, and then they just scrape the mold up. Mold, fungus, and yeast are mercury binders. So if you've got a lot of mold, fungus, and yeast in your gut, you're probably full of mercury. So in that circumstance, then, you kill off all these different varieties of bugs, and then after that, when you're done with that program, then you fill in with your probiotic good bacteria, known as PB Assist. We cleared the path, now we're going to fill it with good guys. So we put in PB Assist, 2 of them with that. You also take the Digest Zen gel caps, again, a somewhat new product. What the gel caps with DigestZen have in them oils that calm down the digestive system. They ease any kind of spastic or inflammatory response. They initiate a healing mechanism, so you get the proper mucosal lining, so you get the proper nerve healing. And you don't understand how profound the connection between your brain and your intestinal system is. Literally, you cannot digest without your brain. You cannot have a brain without your digestive system. They are that interlinked, and oftentimes the colon is called the second brain because it has more nerve endings per square inch than anywhere except your spinal cord and brain. And that nervous system connection is profound. So infection, excessive mucus production, inflammation in the gut does what to the brain? Yeah. Or makes you ADD, or makes you schizophrenic. I mean, not just fuzzy, but serious mental, emotional conditions can almost all be attributed to what happens in the gut. So in that circumstance, get somebody on this program and see how much changes in them, just with one shoot through like this. Now, if somebody has profound digestive problems in their history, I have Crohn's disease, I have irritable bowel, I have diverticulitis, I have all this blah, 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 then you need to go through this several, 2-3 times in a cyclical pattern. But, get them set up on an auto ship and say, you keep that on your auto ship until your digestive system feels just awesome. 2-3 months down the road there, you can go, I don't need this anymore because it feels great. Now, some people might choose to stay on the DigestZen gel caps because it just really does help with the proper bowel movement, helps any spasticity in there, helps with gas production and all kinds of things. So the DigestZen gel caps are very, very good for you. Guess what? This is the thing that people just go, what? During cold and flu season, DigestZen gel caps are the best anti-cold, anti-flu thing in the entire doTERRA line. Not On Guard. Why? Anybody know why? Anybody have a clue what's even in the DigestZen that would do that?
Helps clear mucus.
No. What was the component? What's the oil in there that does the job?
Ginger, peppermint, fennel.
Anise.
Bingo. You know what Tamiflu is? Tamiflu is what they give you if you go into the hospital and you're so sick with the flu they're afraid for your life. They get injected with Tamiflu, right? You know what Tamiflu is?
Anise.
Star anise oil, basically. Star anise oil is, depending on your source, anywhere between 85 and 90% anethole. Anethole is a compound. Now in that chemical is strongly anti-flu, anti-cold. Tamiflu is nothing more than synthesized anethole. So they basically ripped off star anise oil to make billions when they could just be giving people star anise oil.
There's no money.
Yeah, exactly. That's the
I
problem.
have a question. So are you doing 10 days first of just the On Guard caps?
10 days
and then
first of the gel, of
10
the On Guard, then 10 days of the GX Assist, then 10 days of the PD Assist, along with the DigestZen. So in other words, you're going to cyclically get out the big bugs first, then you're going to get out the small bugs, then you're going to put in the good bugs over a 30-day cycle.
Could you just keep going with the
You could
DigestZen
keep
and
going,
PB
yeah.
Assist? And
Yeah,
just
again.
ongoing?
You could, in theory, yes, and there's no reason why not.
Kind of like leaky gut syndrome.
Yeah, leaky gut, this is a fantastic fix for it. Because a lot of leaky gut is these overgrowth, it's now known as, in my day, way back when, they called it dysbiosis. Okay, an inappropriate ratio of bad guys to good guys, is how I phrase that to people. Now they call it SIBO, small intestinal bacterial overgrowth. SIBO, you'll see that phrase out there. It's the same thing. So in that circumstance, the overgrowth of these organisms degrades the condition of the intestinal cells and what's known as the tight junction between them. In other words, there's little bungee cords holding the cells together so that they don't separate. That overgrowth of organisms causes such a chemical mishmash that those bungee cords disintegrate and now the cells start to drift apart. That's leaky gut. That means that not just nutrients are getting out, it's waste getting out, which isn't too pleasant a thought, but that's why it can affect every system in the entire body. The immune system just goes nuts because it has to clean up all this waste that's constantly pouring out of the gut. So in that case, this is a very good beginning to leaky gut healing, yes. So again, you get rid of the bad guys, you get the good guys in there. The probiotics are going to then condition the tube of the intestine to now be pro-growth and repair. So that again,
So, you do the On Guard for the first 10 days,
Are you taking Digestin and PD Assist?
The Digest Zen is an option to go all the way through or just during the PD Assist period of time, whichever you want to do, however much you want to take. I will not limit you on how much Digest Zen you can take.
Could you just do the oil, like on your stomach too? Is
Well,
that just as good? or-
Thank you for bringing that up. There's a difference between capsule and oil. And she has some knowledge of the product, for those of you who don't. There's both the essential oil liquid in a small bottle, and then there's the pre-made capsules. They're for two different purposes. There are two different uses here entirely. The capsule, as we noted, is for the intestines. When you swallow it, it goes through the stomach. Stomach doesn't have anything to do with that. It goes into the intestinal environment. Then that shell melts, and now it releases the oils to have their effect on the intestinal environment. That's what the capsules are for. So for people with intestinal problems, that tends to be the better thing. However, there's a mechanism of your taste that has a profound effect on what I call the GI, the digestive belt: stomach, gallbladder, and pancreas. When you eat something that tastes sweet, that is, in nature, almost always safe to eat. Sweet equals safe as far as our taste buds go. So fruit. Generally speaking, you're not going to get poisoned if you eat any fruit. If something tastes salty or sour, it's a little less safe, but still on me, you can eat that though. The bitter, which is on the back of the tongue, tends to be a taste that in nature, things that are poisonous are bitter. So we tend to not like bitter flavors. In that circumstance, if we do happen to eat something bitter and swallow it, what happens in response in our digestive system is we increase hydrochloric acid production, we increase the bile response, we make more enzymes in the pancreas in order to break down and digest the poison. Now, we can use a little trick of our taste system to cause us to digest better. When we take the Digest-N oil and put it on our tongue, we taste the bitter. Because we've tasted it prior to our eating, now our increased enzymes are already there waiting for the food. Here comes the food, digestive enzymes are maxed out, you're going to digest your food better.